Have you ever felt that sinking feeling? You finally get rid of your vertigo. The room stops spinning, life starts to feel normal again, and then a few months later, you roll over a bed, look up at a shelf, or bend down to tie your shoes, and suddenly the room is spinning all over again. If you've experienced recurring BPPV, you know exactly how frustrating that cycle can be. Now, most people think the reason is it keeps coming back is because they didn't do the Epley's maneuver correctly. But what if that isn't the real reason? What if your body is actually missing something that helps keep those tiny inner ear crystals healthy and in place? Today, we're going to rank the 5 supplements with the strongest scientific evidence, or at least the strongest biological rationale for helping reduce recurrent BPPV. And here's what's interesting. The supplement with the strongest evidence isn't expensive. It isn't exotic. And it probably isn't the one you've seen influencers talking about online. In fact, randomized clinical trials have shown that correcting one common deficiency can significantly reduce chances of BPPV coming back in certain people. We'll also talk about 4 other supplements that are often recommended online, explain what the science actually says about each one, who may benefit, who probably won't, and which ones might simply be wasting your time and money. Because before you spend a single dollar on supplements, you deserve to know what actually has evidence behind it. And before we finish today, I'll also explain why one supplement that has almost no direct research on recurrent BPPV still made the list. The reason might surprise you. If you're new here, welcome. My name is Dr. Matthew Posa, and I'm an upper cervical and neurostructural chiropractor in Milton, Ontario, Canada. And on this channel, I help people better understand their dizziness, vertigo, balance disorders, neck-related dizziness, and what current research tells us about different treatment options that are available to you. My goal isn't simply to tell you what works. It's to explain why it works so you can make informed decisions about your own health. If that sounds helpful, consider subscribing because every week I release evidence-based videos designed to help you understand what's really causing your dizziness and what you can do about it. So now let's jump in. Before we talk about supplements, I want to make one very important point. This video is about preventing recurrent BPPV, not treating an active attack. If you're currently experiencing room spinning vertigo that lasts for seconds when you roll over in bed, look upwards, or lie on your back, the treatment with the strongest evidence is still repositioning maneuvers like the Epley's, or my favorite, the reverse somersault. And the goal of those is quite simple. It guides those loose calcium crystals called otoconia back to the part of your inner ear where they actually belong. Supplements don't do that. No vitamin, mineral, or herb can move those crystals once they become displaced. But here's the question researchers have been asking over the last decade. Why do those crystals keep becoming loose in some people? Some individuals experience BPPV once and never really have another episode. Others experience it every few months. Others every year. So what's the difference? Researchers believe for at least some people, nutrition may be one piece to that puzzle. Not the entire puzzle, but an important piece. And that brings us to the supplement with by far the strongest evidence. If recurrent BPV walked into my office tomorrow and I could recommend only one nutrient to discuss with your healthcare provider, vitamin D would be the top of my list. Not because it's trendy, not because everyone should be taking it, but because it has the strongest research supporting it. And honestly, that surprised a lot of researchers. And here's why. Those tiny crystals inside your inner ear, the ones responsible for BPPV, are made primarily of calcium carbonate. Think of them as thousands of microscopic grains of sand that help your brain detect gravity and movement. Every time you tilt your head, these crystals shift slightly and stimulate tiny little hair sensory cells, allowing your brain to know exactly where your head is in space. It's an incredible system, but it only works if those crystals stay healthy and stay where they actually belong. Researchers have discovered that people with low vitamin D levels appear to have a much higher likelihood of experiencing recurrent BPPV. Why? Because vitamin D plays a crucial role in calcium metabolism through the body. Most people think of vitamin D as simply the bone vitamin, but it's way much more than that. Vitamin D helps your body absorb calcium efficiently and maintain healthy mineral balance. If vitamin D levels remain low over time, researchers believe those tiny inner ear crystals may become more fragile, more unstable, making them more likely to break loose. Now, I want you to be careful here. This doesn't mean low vitamin D directly causes BPPV. Health is rarely that simple, but multiple studies, including randomized controlled trials and systematic reviews, have consistently found something very interesting. When people with recurrent BPPV and low vitamin D levels corrected that deficiency, they experienced fewer future episodes compared to those who didn't. Think about that for just a moment. We're not talking about masking symptoms like a drug. We're talking about potentially reducing how often the problem comes back in the first place. That's a completely different goal. And that's why vitamin D stands out from every other supplement we'll discuss today. Now, here's something many people don't realize. The benefit wasn't seen equally in everyone. The strongest improvements occurred in people who were actually deficient or insufficient in vitamin D. That's incredibly important because more isn't always better. If your vitamin D level is already healthy, taking massive doses isn't likely to provide additional benefits and could even create more problems over time. That's why I don't recommend guessing. Instead, ask your healthcare provider for a simple blood test called a 25-hydroxy vitamin D test. It's one of the easiest ways to determine whether your deficiency could be contributing to recurrent episodes. If your level is low, then supplementation may be appropriate under the guidance of your healthcare provider. In many of the clinical studies, participants took between 800 to 1,000 IUs of vitamin D daily, often alongside calcium. Some people with more significant deficiencies required higher doses initially, but those decisions should always be based on blood work and professional guidance. Personally, I often recommend liquid vitamin D because it's easy to take, allows for flexible dosing, and many people just find it convenient. But remember, the goal isn't simply to take vitamin D. The goal is to achieve and maintain a healthy vitamin D level. That's a very different objective. Now, if vitamin D helps your body absorb calcium, that naturally raises another question. Where does the calcium actually come from? And could calcium itself influence recurrent BPPV? The answer is more interesting than you might think. So if vitamin D helps your body absorb calcium, does that mean calcium supplements can also help prevent recurrent BPPV? The answer is yes, but here's an important catch. Calcium doesn't have the same level of evidence as vitamin D by itself, but many other studies showing a reduction in recurrent BPPV didn't use vitamin D alone. Researchers paired vitamin D with calcium because the two nutrients work really well together. And here's an easy way to picture it. Imagine you're building a house. Calcium is the bricks. Without bricks, you can't build much of anything. Vitamin D is the delivery truck. It helps bring those bricks where they're needed. But if the truck arrives and there's no bricks to be delivered, it can't do its job. That's why these two nutrients are so closely connected. Remember, those tiny crystals inside your inner ear, they're made up primarily of calcium carbonate. Those crystals are incredibly small, but they're essential. Every time you turn your head, look up, roll over in bed, or bend forward, they help your brain determine exactly where your head is in space. When those crystals become dislodged, that's when many people experience the spinning sensation we know as BPPV. Researchers have also noticed something interesting. People with lower bone mineral density, including those with osteopenia or osteoporosis, appear to have a greater risk of recurrent BPPV. Now, that doesn't necessarily mean weak bones cause vertigo, but it does suggest something much bigger. It tells us that the way your body manages calcium may also influence the health and stability of those inner ear crystals. That's why maintaining healthy calcium intake is important. Notice I didn't say taking lots of calcium supplements. I said maintaining healthy calcium intake. That's an important distinction. Many people can meet their calcium needs through food like dairy products, leafy green vegetables, fortified plant-based milks, almonds, and canned salmon with bones. If your diet already provides enough calcium, adding large doses of supplements may not provide additional benefits. You're not going to get more. In fact, for some people, too much supplementation of calcium may increase the risk of kidney stones or may not be appropriate if they have certain medical conditions. That's why it's always worth discussing with your healthcare provider before starting any type of calcium supplement. In the clinical studies involving recurrent BPPV, researchers commonly used around 500 to 600 milligrams of calcium daily alongside their vitamin supplementation. Again, the important message isn't that everyone watching should immediately start taking calcium. The message is that healthy calcium intake and healthy vitamin D levels appear to work together. Neither one tells the whole story by itself. And that leads us to something that surprises many people. Even if your vitamin D is normal, even if your calcium intake is adequate, there's another nutrient that quietly helps those systems actually work together. And most people have heard of it. They just don't realize how important it can be. Magnesium may be one of the most misunderstood supplements in all of healthcare. Many people think it helps everything. Others think it's completely overhyped. The truth is, as usual, falls somewhere in the middle. Unlike vitamin D, magnesium has not been shown in clinical trials to directly reduce recurrent BPPV. That's important to know because you'll often see claims online suggesting otherwise. The current research simply isn't there, but that doesn't mean magnesium isn't valuable. In fact, it may still play an important supporting role in overall vestibular health. And here's why. Magnesium is involved in more than 300 biochemical reactions throughout your body. 300. It helps regulate normal nerve function, healthy muscle function, energy production, communication between your brain and your nervous system, and even the way calcium moves within your cells. Think of magnesium as the maintenance crew. If vitamin D is delivering building materials, calcium provides the structure, magnesium helps the entire system running smoothly behind the scenes. You don't always notice it. It's not sexy, but when it's missing, lots of small problems can begin to add up. Now, here's where things become especially interesting. Many people diagnosed with recurrent BPPV don't actually have BPPV alone. Some also experience vestibular migraines, persistent postural perceptual dizziness, or PPPD, cervicogenic dizziness, or dizziness related to neck dysfunction. Sometimes more than one condition exists at the same time. That's one reason dizziness can become so confusing, and magnesium has actually been studied much more in vestibular migraines than in BPPV. Several studies suggest it may help reduce the frequency of migraine attacks in certain individuals. So if someone has both migraine-related dizziness and occasional BPPV, magnesium may offer benefits that extend beyond just the inner ear. If supplementation is appropriate, I generally recommend magnesium biglycinate, also known as magnesium glycinate. Why this form? Because it's well absorbed, gentle on your stomach, and much less likely to cause things like diarrhea than other forms of magnesium oxide. The other bonus is that glycine, the amino acid attached to magnesium, in this form may actually have calming effects on your nervous system. Many people also find they sleep better while taking it. Typical doses range between 200 and 400 milligrams daily, depending on individual needs. But remember, more isn't better. Taking excessive amounts can cause diarrhea, upset stomach, and people with significant kidney disease should only supplement under medical supervision. So where does magnesium fit in today's list? Not because it has strong evidence for preventing recurrent BPPV. It doesn't. It made this list because it supports several of the body's systems that contribute to healthy balance, nerve function, and vestibular performance. It's an example of looking at the whole person rather than focusing on just the tiny structure inside the ear. But now we're about to move into a supplement that generates far more debate. Some people swear by it, and others say it's completely ineffective. The research, however, is somewhere in between. So let's talk about Ginkgo Biloba. So far, we've looked at supplements with the strongest biological connection to recurrent BPPV: vitamin D, calcium, and magnesium. Each one plays a different role. But now we're moving into supplements that generate a lot more debate. If you spent any time researching online for natural treatments for vertigo, you've almost certainly come across Ginkgo Biloba. Some websites call it one of the best supplements for dizziness. Others say it doesn't work at all. So who's right? The answer is a little bit more complicated than either side would have you believe. Let's start with what we know. Unlike vitamin D, Ginkgo Biloba has not been shown to directly prevent recurrent BPPV. If you're looking specifically for high quality studies showing that Ginkgo keeps those tiny inner ear crystals from becoming loose again, they simply don't exist. So if I stopped there, I'd probably tell you to skip it. But here's why I didn't leave it off the list. Ginkgo hasn't been studied only in BPPV. It's been studied in dizziness and vertigo much more broadly. Researchers believe it may improve blood flow to the tiny blood vessels that supply the inner ear and certain areas of the brain involved in balance. It also appears to have antioxidant properties, meaning it may help protect cells from oxidative stress. Now, that doesn't automatically mean that it prevents recurrent BPPV. Absolutely not. Those are two different questions, but it does provide a reasonable biological explanation for why some people with chronic dizziness report improvement while taking it. Here's another point that's often overlooked. Many research studies involving Ginkgo were limited to one diagnosis. Some participants had vestibular disorders. Others had age-related dizziness. Others had mixed causes for vertigo. Because of that, it's difficult to know exactly how much of the benefit came from treating recurrent BPPV itself versus helping other causes of dizziness. And that's an important distinction. This is one of the biggest mistakes I see online. People often take research involving dizziness and automatically apply it to BPPV. But dizziness isn't a diagnosis. It's a symptom. It's a little like saying knee pain, a torn ligament, arthritis, a fracture, and tendonitis can all cause knee pain, but they don't all respond to the same treatment. The same is true for dizziness. BPPV, vestibular migraine, Ménière's disease, vestibular neuritis, persistent postural perceptual dizziness, cervicogenic dizziness. These are all completely different conditions, even though they all make you feel dizzy. That's why getting the correct diagnosis matters so much. If you do decide to try Ginkgo, look for a standardized extract called EGB761. That's the preparation used in many of the clinical studies. Typical doses range from 120 to about 240 milligrams per day, usually divided in 1 or 2 doses. But there's one important safety consideration I need you to think about. Ginkgo may increase the risk of bleeding. If you're taking blood thinners such as warfarin, antiplatelet medications, or you're planning on surgery, always speak with your healthcare provider before taking it. So where does Ginkgo rank? Well, it's not at the top, not because it's ineffective, but because of the evidence for recurrent BPPV simply isn't nearly as strong as it is for correcting a vitamin D deficiency. Could it help some people? Possibly, especially if their dizziness involves more than one vestibular condition. But if recurrent BPPV is your only diagnosis, I would focus on the supplements with stronger evidence first. And that brings us to our final supplement. Ironically, this one may be the least talked about, yet it completes the story we've been building throughout this entire video. Let's go back to our house analogy. So remember, calcium is the bricks. Vitamin D is the delivery truck. So here's the question. Once the bricks arrive, who tells the workers where to put them? That's where vitamin K2 comes in. Vitamin K2 activates proteins that help direct calcium into your bones and your teeth, where it's actually needed the most, while helping reduce calcium being deposited in places where it doesn't belong. Think of vitamin K2 as the construction foreman. Without a foreman, the delivery trucks can still arrive, the bricks are still delivered, but they may not end up exactly where you want them. That's why many clinicians recommend pairing vitamin D3 with K2, particularly where vitamin D is being taken long term. Now, I want to be completely transparent. Unlike vitamin D, we do not have clinical trials showing that vitamin K2 alone prevents recurrent BPPV. That's not why it's not on today's list. It's here because it supports healthy calcium metabolism and biologically it makes sense alongside vitamin D. Sometimes biology gives us reasonable hypotheses before large clinical trials are actually completed. That's exactly where vitamin K2 fits in today. The evidence is promising from a psychological standpoint, but incomplete from a BPPV standpoint. If you choose to supplement, the form most commonly recommended is MK7, which remains active in the body longer than other forms. Typical doses range between 90 and 120 micrograms daily. You'll also find many high-quality supplements that combine vitamin D and K2 in the same bottle, which is what I have here at my office for my patients. One important precaution though, if you're taking warfarin or other vitamin K sensitive anticoagulants, don't start vitamin K2 without discussing it with your healthcare provider. It can interfere with how those medications work. Now, let's step back for a moment. Notice something interesting about today's list. Only one supplement has strong evidence showing it can actually reduce recurrent BPPV in people with low vitamin D levels. Everything else supports that goal in a different way. That's an incredibly important takeaway because the internet often treats every supplement as though the evidence is equal, and it simply isn't. Some recommendations are supported by randomized clinical trials. Others are supported mainly by physiology and indirect evidence. Knowing the difference helps you make better decisions and spend your money more wisely. But here's the question that matters most. If supplements are only one piece of that puzzle, what should someone with recurrent BPPV actually do next? So let's put everything together for you. Let's take everything we've discovered today and make it practical. If I were someone dealing with recurrent BPPV, here's how I would approach it. First, I wouldn't start by buying 5 different supplements online. I'd start by asking a much simpler question. Why does my BPPV keep coming back? I mean, for some people, it might just be simple bad luck. But for others, there may be underlying factors that deserve a closer look. One of those factors is the vitamin D deficiency. And based on the research we have today, that's where I would start. I would ask my healthcare provider for the 25-hydroxy vitamin D blood test. If my vitamin D levels are low, I'd work with my healthcare provider to correct the deficiency because it has the strongest evidence for reducing recurrent BPPV in people who are deficient. Next, I'd make sure I was getting enough calcium, whether through my diet or supplementation if appropriate. Then I'd consider whether magnesium might make sense based on my overall health, especially if I was also experiencing migraines or other vestibular type of conditions. Ginkgo biloba? Possibly. But I'd recognize that the evidence for recurrent BPPV specifically is much weaker. And vitamin K2, I see it as a logical partner to vitamin D because of its role in healthy calcium metabolism, even though we still need more research specifically looking at recurrent BPPV, but I do recommend it to all my patients. If you're taking vitamin D, you need K2. Notice something about the plan. It isn't based on hype. It isn't based on internet trends. It's based on asking the right questions first, then choosing supplements that actually fits your clinical situation. And honestly, that's how I think healthcare should work. There's one more thing I'd like you to remember. Supplements are exactly that. They are supplements. They're designed to supplement an overall approach to your health. They don't replace an accurate diagnosis. They don't replace appropriate treatment. And they certainly don't replace understanding why you're experiencing dizziness in the very first place. Because here's what I've learned after treating people with dizziness for years. Sometimes recurrent BPPV really is just recurrent BPPV. But many times it isn't the whole story. I've seen people who initially thought they only had BPPV, but were also dealing with vestibular migraines, persistent postural perceptual dizziness, cervicogenic dizziness related to the neck, or even multiple conditions occurring at the very same time. That's one reason dizziness can become so frustrating. Different conditions can feel remarkably similar, yet require very different treatment approaches. The better you understand what's actually causing your symptoms, the better your chances of choosing the right treatment. That's exactly why I created this channel. Not to convince you that every answer is chiropractic, even though I do think everyone needs a chiropractor because you have a spine and you should be taking care of it, not when it decays, but before that. Also, not to convince you that every answer is supplements, but to help you understand that science, the possibilities, and the different pieces of the puzzle so you can make informed decisions about your health. Now, I'd love to hear from you. How many episodes of BPPV have you experienced? Did you get a proper diagnosis? That's key. Or are you self-diagnosing? Does it just come back every few years? Or are you someone who feels like you're constantly waiting for the next attack? Let me know in the comments below. I read as many of your comments as I can, and they can also help me decide what videos to actually create next. In fact, many of the videos on this channel have come directly from questions you've asked in the comments. And if you found this video helpful, please, can you do me a little favor? Click on the like button. Not because it helps my ego, but because it actually tells YouTube that this information is valuable, which means that it has a better chance of reaching more people who's lying in bed right now wondering why their vertigo keeps coming back. You never know who you might actually help by doing something so simple. And if you enjoy evidence-based videos that explain dizziness, vertigo, balance disorders, neck-related dizziness, back pain, neck pain, anything to do with your health on my channel, as well as the latest research that's easy to understand, I'd love to have you join my community. Please subscribe to my page, turn on the notifications so you don't miss any of the future videos. Now, if you've tried the Epley maneuver over and over, but your vertigo isn't improving, or maybe it has helped at first, but it seems to make things worse, here's a very important reason that can happen. It doesn't always mean the maneuver failed. Sometimes it means something else is going on. In this next video, I'll explain 3 alternative maneuvers, why the Epley's doesn't work for everyone, and how to recognize when your dizziness may not actually be coming from loose crystals anymore. If you want to stop guessing and better understand what's causing your dizziness, click on that video right now. I'll see you there.